and thank you for joining us for the May GATE Equity webinar, where we explore topics related to equity and graduation success. This webinar will be recorded and will be posted in the next couple of weeks. The PowerPoint is posted on OSPI on the GATE Equity webinar page if you want to follow along right now. I'm Kathy Anderson, OSPI Graduation Equity Program Supervisor, and today's topic is Mental Health 101, Crafting an Integrated System of Supports. We chose this topic because statewide we're working toward a whole child focus. We want students to be able to come to school and learn, and for schools to honor the needs of its students with supports that make that possible. Having a systems approach is vital to noticing students who might fly under the radar, and we want to help you get started. Today, we're going to get you an overview of a really useful tool, the SHAPE system, for assessing how your school is supporting students with behavioral health. And you'll learn the big supports ideas that are framing the Navigator's pilot. It's a pilot designed to connect schools with regional health supports with Camille and Andrew. And you'll get to hear firsthand from Cheney school districts about how their first year of implementation has been going. So I'm joined today by Camille Goldy. She's a behavioral health and suicide prevention program supervisor here at OSPI, and she's brought along Andrew Bingham from ESD 101, who is a behavioral health systems navigator and connects schools to those supports. We also have Kathleen Schlatter from Cheney Public Schools, who's going to be talking about Cheney's first year of implementation and what they've learned from that and how they're crafting their integrated system of supports. So thank you all for being here. Our vision at OSPI is all students prepared for post-secondary pathways, careers, and civic engagement. And this webinar is brought to you through the Office of System and School Improvements. We are going to continue this conversation this afternoon. This afternoon we're going to be talking about Mental Health 201, Elementary and Early Learning Strategies. We'll have Sarah Ellsworth from ESD 113 with us, as well as Shelton School District and Bonnie Zimmerman, best facilitator ever. So we hope you can join us for the second half. Next month, we are going to be talking about graduation, so supporting what's next, and we're also going to talk about alternative learning experience. So these links will be in the chat if you want to register now, and please share with friends who might be interested coming up. We do like to start off our webinars with polling just to see who is in our audience. So if you can let us know who you are and how familiar you are with our topic, that would be really helpful to us to make sure that we are answering to who we have in the room and are making this as relevant as possible. And while you do that, just a reminder, if you have questions for our presenters, please put them in the Q&A, and we'll make sure that we're monitoring that Q&A function really carefully. As we go along, we're going to pause at the polling slides for those questions so they will get answered. And I want to share out how many people are here. So I'm going to share these results with you. It looks like we've got some administrators and counselors. And if you could tell us in the chat, what's your role? We want to figure out who's with us today. And we are somewhat familiar with the topic. And we've got some new in there too. That's great. We're so glad that all of you guys could join us. The first person that's going to be talking today is Camille Goldy, and she is our program supervisor to talk about her work on behavioral health. So Camille, do you want to get started?
Sure, Kathy, can you hear me?
I can hear you great. Thank you.
Okay, great. Thank you. Excuse me. Good morning. This is Camille Goldy. As Kathy introduced, I work with her closely at OSPI. I work in the student support section, and I'm going to be talking with you today about a project that I've been working on for the last 2 years with our 2 ESD partners on behavioral health and linking behavioral health to the education system. Kind of quickly getting into some definitions before we go further. When we talk about behavioral health for this context, for this project in particular, we're really talking about behavioral health as it's defined by the healthcare sector. So this includes mental health and substance use disorder prevention, intervention, treatment, support, often confused with behavior and discipline in the school context, which often gets associated with special education. And so I just want to be clear that we are talking about access to healthcare services with this project. To give a little bit of context for the project that we have been doing, OSPI has been tasked by the legislature to participate in a work group that was established in 2016, which is called the Children's Mental Health Work Group. It is the membership consists of members from the healthcare sector, from providers of health services, legislators and policymakers from public and private organizations, and then OSPI is a member of that work group. The purpose of the work group is to investigate the access issues for children for behavioral health services. We have a lot of good data around understanding that even if children have healthcare coverage for behavioral health services, they're not accessing. So as a result of that work group, they made recommendations to the legislature, and several of those recommendations were then put into legislation to task multiple organizations to do things across the healthcare and education sector, including early learning. OSPI was tasked with doing this pilot project that we're going to be talking with you about. So the purpose of the project was really to investigate if one person in a region, so staffed by the ESD and serving the districts in the region that ESD covers, if they are really able to be the linkage and increase access to care for children. And this project was specifically noted to be for Medicaid eligible students, primarily because that's what our public system funds, and that's really where legislature has the power. The purpose of this was to do this investigation, and then we are working on a legislative report that will be delivered to the governor and legislature in December. So a little bit more detail about the project. The two ESDs that were selected to participate were ESD 101, which is where Andrew is based, and he serves the 7 counties and 59 school districts in that region. And then Capital Region ESD 113, which is in the Olympia region, and they serve, I believe it's 5 counties and 45 school districts. This project really created a close cross-agency partnership at the state level between our healthcare authority, which is our state Medicaid agency, and OSPI, and really formalized our work together, primarily because the way the project was funded was through federal Medicaid match dollars. And so that really put some parameters on what was allowable with this funding source, and it kind of helped us really stay focused within the scope of the project. Before we really launched into the work, we worked with an evaluation contractor who is working with us on our case study, along with our project partners at the ESDs, to establish some project goals and purpose. We built some awesome logic models and really tried to get clear with what are our goals and objectives in order to be able to complete this task. So the goal of this project is to increase equitable access to behavioral health care for students in need through state and regional level cross-system collaboration in schools and communities. And the purpose is to investigate if one person at an ESD can really make a noticeable difference. This project supports our state Medicaid plan, which is really important to stay aligned with the funding source, but also is aligned with trying to get better access for healthcare for kids. We believe that this project is able to leverage existing funds to kind of help schools engage with what is already available to them through Medicaid, in hopes for being able to advocate for more funds. And then, establishing the why, which I think most of us already can share our whys around mental health with students. This is something that we hear often. We have survey data from the superintendent survey, and there's been a huge noticeable need for mental health supports in schools. We also have data to support that, and we have data to show that in Washington state, needs are higher than the access. And so the purpose of this project is to try to reconcile those needs and access. The Navigator role in particular, so what are Andrew and Sarah Ellsworth and ESD 113, what are they really doing? So their work started in about, by the time everything got settled, December of 2018. We had about 18 months to do this project. And their work was to really set out and assess what was happening in their region in terms of healthcare transformation, which is something that's happening through what our state is calling accountable communities of health, which are regional organized processes for increasing access to healthcare for families and people on Medicaid. And the Navigator was tasked with very specific deliverables out of the legislature, which had to do with coordination, facilitation, integration, and collaboration. The Navigator is not providing direct service. They are really the linkage. They are the conduit. They're the communicator. And that is something that we had to be really clear about with this work. Okay, so activities, specifically, what are those navigators doing? So starting out, establishing a point of contact at each of the school districts in their region, working with them to kind of assess what's happening in their district around behavioral health services and kind of the payment of those. So our districts being able to access Medicaid reimbursement for those services and the other Medicaid reimbursement programs available to them. And that basically was that within these regional accountable healthcare transformation. And so the work of the Navigator was really critical in being able to say this person is dedicated to link these two systems between healthcare and education, and are able to show up at that table and talk about what schools really need and what it's really like to try in schools and build the relationships to be able to create those systems and improve upon them. What we learned, or what we're working towards, is being able to work with the healthcare plans that pay for Medicaid services and trying to link those with ESD and school districts so that they can be able to improve access to all students available, or all students eligible for Medicaid. And then lastly,
Kathy, I'm not monitoring the Q&A, but if there are questions that I need to go back, will you let me know?
Absolutely, Camille. Keep going. You're doing great.
Awesome. Okay, so then lastly, what about all the other students who are not eligible for Medicaid, which has been a question that we get asked a lot, and really what we hope the Navigator role will be able to do as they continue forward is be able to understand what private healthcare reimbursement might look like for schools and improve upon how services can be made available to all students in the schools, not just those eligible for Medicaid. So we have a case study that's due to the legislature, and what we really wanted to be able to do was answer the questions within the legislative directive. So we got really clear about what were those questions and how are we going to be able to measure them based on some monthly reporting as well as some stakeholder interviewing. And we worked really hard to kind of determine what are our assumptions with this work and see if those assumptions are true, and if not, why not? And then be able to answer the questions about how can we increase access to care, an ESD, FTE, and Navigator role able to integrate within the healthcare system so that we can increase access to care. And then is it sustainable? So is this something that if the Navigator can help school districts engage with the healthcare system, is this something that can generate resources in order to invest in their healthcare system or healthcare services in the school? So what are we learning? So we're getting really close to the end of this project, but kind of during the interim of the 2-year project, we did an assessment of, how can we help people understand that we believe this project is going to be successful. And, what we know is that there isn't a dedicated person to do this work for the most part in an ESD or in school districts. So having someone whose key focus is that and being really clear and kind of narrow with their scope was pretty effective. And there's a huge need for someone to be able to focus and gain understanding of how healthcare reimbursement can happen in a school setting and kind of all of the barriers that are in place for that, and being able to communicate about what might need to be removed and trying to improve the system. And also that really local healthcare transformation is happening around our publicly funded system, and the K-12 voice is an engagement with the K-12 engaging in that work is really important, because change is happening and it's a really good opportunity to influence decisions and programs and access points if folks from the school setting can be part of that conversation. We've seen a huge opportunity for further partnership with our healthcare authority here at OSPI, where we will continue to work on identifying barriers and determining if there are ways to reduce those barriers, and then really just kind of see several future opportunities for hopefully improving these two systems to be better equipped to work together. So with that, I'm going to turn it over to Andrew to talk about kind of more of the details of what he has done in the last 18 months and how he's been able to do it. And then Kathleen, I'm excited for her to share about their work as well.
Thank you, Camille. Good morning or good afternoon, everyone, depending on where you are calling from. My name is Andrew Bingham. I'm the Behavioral Health System Navigator at the Northeast Washington Educational Service District 101 here in Spokane. For the last year, I have been exploring school-based Medicaid options, and there are two options in particular that I'm going to be sharing about. The Washington State School-Based Healthcare Services Program, that's on the last slide, thank you, is an optional Medicaid program administered by the Healthcare Authority, that's the HCA. The SBHS program reimburses contracted school districts, educational service districts, charter, and tribal schools for Medicaid-covered health care-related services provided to Medicaid-eligible students. So in order to receive Medicaid reimbursement through this program, services must be included in the child's Individualized Education Plan, IEP, or Individualized Family Service Plan, IFSP. Service providers must be licensed by the Department of Health, and covered services are limited to evaluations and reevaluations to determine if a student needs special education or early intervention health-related services as part of their IEP or IFSP. Health-related services, including the child's IEP or IFSP, are limited to audiology services, counseling services, nursing services, occupational therapy services, physical therapy services, psychological assessments, and speech-language therapy services. Medicaid reimbursement allows school districts to receive discretionary funding for services they are already providing. When we began the pilot, only 10 out of our 59 school districts were participating, and very soon ESD 101 will begin billing on behalf of 29 of our school districts. The second Medicaid program is Medicaid Administrative Claiming Program, MAC for short. The Healthcare Authority is able to contract with districts to reimburse them a portion of their expenses for performing administrative activities that support the goals of the Medicaid state plan. District staff participate in a random moment time study to determine what percentage of their time is spent performing reimbursable activities such as outreach, application assistance, and referring students and families to needed healthcare services. Examples of staff eligible to participate in MAC: elementary and secondary principals, office and clerical staff, school administrators, counselors, social workers and nurses, physical and occupational therapists, speech-language pathologists and audiologists, teachers and paraprofessionals. Participating districts use a web-based random moment time study claiming system. Staff receive emails that ask them to describe a 1-minute interval of their workday. The typical time it takes to respond to the study is 1 to 2 minutes. When the fiscal quarter ends, the time study determines the percentage of staff time statewide spent performing reimbursable activities. Districts then receive discretionary funding based on the statewide performance. Only 3 of our 59 school districts currently participate in this program, with many districts saying they stopped participating years ago when the program used to be much more complicated. Districts also cite that the new program is, quote, too good to be true, and they ask, what's the catch? The reality is that there is no catch, but even a simple program makes districts uncomfortable when Medicaid is involved. Next, in order to properly start a conversation about Medicaid participation and behavioral health, you're going to want to establish a few things. First, you will need a team that is comfortable with having an honest conversation about the social and emotional needs of not only your Medicaid population, but all of your students. Second, you will need a way to guide the conversation that doesn't just admire the problem, but measures your readiness to benefit. Third, your team will need to create a shared vision, one cohesive understanding of where you are and how you can move forward. Now, there are many processes and programs available to help your team get started, but the one that I have had the most success with, that I encourage school districts to try, is SHAPE. SHAPE is the school health assessment and performance evaluation system. It's free, it's an interactive system. It's designed to improve school mental health accountability, excellence, and sustainability. The University of Maryland School for Medicine has developed and implemented this system through federal funding, which was recently approved for another 5 years. The SHAPE system, as I mentioned, is 100% free, which helps districts get started without committing limited funds. School districts complete comprehensive assessments to measure quality and sustainability of their services and supports. Districts receive individualized reports that score essential domain components. Districts participate in a strategic team planning process to create a roadmap for their success. Districts have access to the Resource Center and choose quality guides based on their readiness to benefit. If districts choose screening and assessment as a priority, SHAPE's library will guide instrument identification and implementation. At the start of the pilot, a little over a year ago, one school district was using this system, and now we have 22 school districts using the SHAPE system. So next, I'm going to get into a little bit more detail. So first, the comprehensive assessment measures the quality of services and supports within your school district. These domains are teaming, your team's composition and meeting process, needs assessment, resource mapping, measurement of student mental health needs and school-based resources, screening through a systematic tool or process, programs, services, and supports based on scientific evidence, integration of your research findings, the outcomes and data that you have available, and then those data-driven decisions which are meant to be informed and objective. Next, we have the second assessment, which is the sustainability of your district's services and supports. The domains within this assessment are funding and resources, what financial and non-financial assets can you leverage, resource utilization, how are you currently leveraging the resources that are at your disposal, system quality, the overall quality of services and supports provided to your students, documentation and reporting of impact. As we know, it is critical to document and report the impact of your system, because if it isn't documented, it didn't happen. And then system marketing and promotion, actively reaching a wide range of stakeholders to partner with and participate within your system. So next, after completing an assessment, your district receives individualized reports that score essential domain components. Scores are red for emerging, yellow for progressing, and green for mastery. You'll notice some strengths-based language there. One of those examples on the next slide is the domain for teaming. The SHAPE assessment asks questions pertaining to and scores your district's ability to have a multidisciplinary team, promoting efficiency, meeting best practices, promoting data sharing, and connecting to community resources. Next, at the end of the individualized summary report is the strategic planning guide. Here the team prioritizes and scores 3 domains and their need for change, desire to change, resource to achieve change, and barriers to change. Every team member needs to come prepared to have the tough conversation of what needs to be prioritized and what needs to wait based on practicality. This exercise is meant to facilitate a conversation to determine readiness to benefit. At the end of the strategic plan, the team creates goals, indicators of success, action steps, and a timeline for improvement. The strategic planning guide is then meant to serve as the roadmap for the school district's success. Next, the district can then access the Resource Center and choose quality guides based on those prioritized domains. For the quality guide for teaming, the guide provides a step-by-step process that approaches the fundamentals of the teaming process. So step 1 is building a multidisciplinary team. Step 2, ensure efficient team structure and practice. Step 3 is use and share data. And then finally, maintaining working relationships with community providers. Even school districts that have a good foundation for services and supports will greatly benefit from reestablishing those first steps of success. Next, if school districts choose screening and assessment as priority, SHAPE's library will guide instrument identification and implementation. Teams can filter tools based on focus area, assessment, purpose, student age, language, reporter, and cost. Finally, I would like to share that one of my school districts prioritized data collection and screening as their #1 domain after receiving low scores within their assessments. During the strategic planning guide, the team recognized that the need for change, desire to change, and resource to achieve change were very high, while the barriers to achieve this change were very low. The district team discovered the strengths and difficulties questionnaire through SHAPE's library and decided to use the instrument district-wide for approximately 1,400 students. They chose to contract with the developers at Youth in Mind USA to digitally implement the tool. Teachers completed the STQs for students aged 4 through 10, and students 11 and older completed through self-reports. Students were then scored and categorized using multi-tiered systems of support. The STQ tool screens for anxiety, depression, disruptive behavior, global functioning, hyperactivity, and social skills. But if you read a few of these questions, they aren't as intrusive as you might expect from a tool that measures all of that. Some of these questions include, I try to be nice to other people. I care about their feelings. I would rather be alone than with people of my age. I worry a lot. I have one good friend or more. I am nervous in new situations. I easily lose confidence. And that's scored on a not true, somewhat true, and certainly true scale. So in my opinion, this tool isn't likely to make students feel uncomfortable or upset them with intrusive questions. And I don't believe that it's one that parents are going to be calling in complaining that students were upset by intrusive questions. There are many other screening and assessments like the SDQs and many other systems and programs similar to SHAPE. You can access the SHAPE system through theshapesystem.com, and you can learn more about the strengths and difficulties questionnaire on youthinmindusa.com, and I will send that right now. This whole process is really about getting started and starting off on the right foot for your path to better services and supports in your schools. That's everything for me. Thank you again for participating in this webinar.
Thanks, Andrew. And just so that people are aware, if you want someone like Andrew in your region, the pilot's expanding from these ESDs coming up to an area near you, so you can take advantage coming up. And we're going to have on next Cheney School District, or I'm sorry, Cheney Public Schools. And Kathleen Schlatter is here with us, and we're going to put on hold so that we can learn a little bit more about how you're feeling about all of this. And how interested are you in the SHAPE system? Very somewhat, and it's new. And again, this is just one tool. This is one way to go about it. It's a nice way to see how your school is doing with the basic implementation of supports and what you can do a little bit differently to remove barriers and just identify what they are. We're going to give you another 30 seconds, and Kathleen's going to grab the screen share and share her screen so that she can share her story of how they're implementing kind of with Andrew's guidance in the Cheney Public Schools. But while we wait for her to grab the screen, we do have a couple of questions for Andrew. Can Gen Ed students access an IFSP? Can you talk a little bit about that?
So in order for a student to have an IEP or IFSP, they need to go through the special education and do psychological screening through the special education process within the school district.
Mm-hmm. And this person doesn't know a lot about what an IFSP is in general. They know the acronym, but not the process. Can you talk a little bit about what the process is?
So IFSP stands for Individualized Family Service Plan. It's for those students who are essentially younger and have yet to receive an IEP. The process, as I mentioned, similar to an IEP, it's really about going to that special education program director, asking that they receive those psychological assessments, and then creating determinations to see if they are eligible for those audiology, physical, occupational therapy, speech language pathology, audiology services.
Okay. How do you participate in the RTS?
Yes, so let me grab the link for Medicaid administrative claiming. So I will grab that so that school districts can learn more about that. And then you'll contact the program manager on their site here, and they can give you all the details. His name is Jonathan Rush, and he can walk you through the steps of becoming essentially a contracted person through the MAC program.
And Andrew, does the Medicaid match only pertain to IEP kids?
No, it does not. So the Medicaid administrative claiming, the MAC program is reimbursement for any kind of educational or awareness offerings about Apple Health. And then the SBHS program is only for students on IEPs and IFSPs. That reimbursement is limited to that.
And we do have one more question, but I think we're going to type the answer. So hang in there, Peggy, okay? And Kathleen, I think we're going to go to you. What does implementation look like, and how's that going in Cheney Public Schools?
Yeah, this is Kathleen. I'm Kathleen Schlatter, actually newly married. My new last name will be Scott, and I am from the Cheney Public Schools. I have a few roles here in Cheney. One, I'm our Director of Social Emotional Learning, as well as responsible for alternative learning environments here in Cheney. And so I wear a few hats. I do have a person who supports me with social emotional learning. Her name is Kim Leffler. And that's part of our journey, is that we actually have developed and made a few people who are leading this work in our district. I think our why has really stemmed from a desire to support all kids. As you're going to hear throughout this presentation, that has become a mantra for our school district and for what we believe in. And so we truly are working to develop systems that address all kids. It's been a journey, so we're going to talk about that. We've been on this journey for several years, but feel like we're really getting organized at this point in the process, finally. Some key things for us to think about, and as you listen to this presentation, is the importance of understanding that academics and social emotional learning don't stand alone, and that's been a very important part of our work. And I'm going to talk about a little bit about how Andrew has begun to support our work, as well as our next steps, and then most important, what we've learned not to do, as well as what we're going to continue to work towards in our future. So I'm sure many of our school districts in our state have implemented PBIS. That's something that we implemented 7 years ago in our district, 8 years ago, some schools even longer. And PBIS has been an integral part in supporting the core of instruction. In addition, we were partnering with WSU as a part of a CLEAR grant, and several of our schools did some very extensive training around trauma-informed practices. Professional learning communities. 3 years ago, our school district started very purposefully investigating and studying implementation of professional learning communities. And then last year, actually dove in and we've done a lot of work in our school district around prioritizing our standards and working towards that guaranteed and viable curriculum. What's most interesting, and of course does my heart well, since social emotional learning is where my heart is at, is that of course our teachers and our staff and our administrators are all saying, yes, we need to do this work, and we can't do it without addressing the needs and barriers of our kiddos. And then add on to that, discipline law changes. Again, providing training and support and all of those things for all of our administrators. And how do we help our staff, though, understand that law change and how that fits into what's best for kids? So those are some of the things that we were taking a look at. So we had a joint study committee that looked at behavior. We've had an intervention framework that we adopted many years ago, and then quickly recognized as we've done the work that we were missing some really important pieces. So we've kind of circled back over this last 2 years and really been refocusing our thoughts and refocusing next steps for us. So some of the themes that we've noticed, I imagine all of you are experiencing within your schools. We have some definite barriers that get in the way of our students having success in school. So trauma, mental health issues, behavior concerns. We've tried to, instead of focusing on the negative and the things that are in our way, we've really started to think about the why. And that's been a really big part of our work, is the why. And for me, the why are our students and our staff. We recognize that several kids come to us with needs that are barriers for them, but we can't let that be an excuse to not support them. So we've begun beefing up our alternative programs. We've begun providing professional development, and we have mental health services in our schools. That's where Andrew comes in. We've had this amazing, wonderful grant, and now that grant's going away. And so we're looking to find sustainable ways to provide that kind of tier 2 or tier 3 supports for our kids. And so partnering with him is our goal for as we move forward to continue to provide those services. We spent a lot of time in this part of looking at our data, and part of that why is, as a district, our graduation rates aren't what we want them to be, and we recognize that part of the reason is because we need to address some of these more significant issues that our students are dealing with. And so we've set some goals as a district, and we've been working our mission statement this year and our vision for what that looks like. And you will find when we roll that out at the end of this school year that it's just as much about safety and caring and meeting the needs of our kids or socially as it is academically. And that has become a truth in our district, which makes me very proud of the work we're doing. So with all of these things we've done in the past, one of the things that, we've learned is that we have some pretty incredible people right within our own school district who can support this work moving forward. In the past, we brought in a lot of consultants through the CLEAR grant, through PBIS, and all of those things in pockets were really incredibly positive and wonderful for our kids. But what we've found is that, or what we've decided and what we've been working towards this school year, is really organizing ourselves to provide professional development for our staff that we have in district. And then they're taking that out to our other staff within our buildings. And so that has become our focus, is really providing intentional, embedded professional development rather than bringing in outside experts to provide that for pockets of our staff. And so I feel like that's been highly effective, because the relationships that our staff have with our principals and our counselors and is so much stronger and already established. And so we don't have to have that time invested in building relationship with an outside consultant. So, but what we've done then instead is use some of those resources to support our leadership team and our counseling team, and then they're taking it out to our school staff. We also have team leaders from every department and academic grade level. So for elementary, for example, we have our professional learning community team leaders so that's that organization piece where we bring them together as a district, our admin team, once a month. And we provide professional development and support to them. And then they take that out in an accordion style back out to their buildings and in their small teams that are 3 to 6 people, maybe 10 in the high school in some areas. And then they bring that feedback back to our district team. So we've done that with primarily academics, but we've begun to tackle it the same way with our social emotional supports and how we're going to continue to support our schools. So a big part of tackling a big system is looking at school culture. All of our administrative teams and counseling teams, we've read the book Transforming School Culture from Anthony Muhammad. And we've done a lot of training for our staff around professional learning communities and helping them to recognize that we have to meet the core needs of our students social emotionally. And so in addition to meeting their needs academically. Some example supports, this is like what I would expect we would see in many schools, although I want to say that we've become much more intentional about it. And so as a district, we use the DESA screener, which is a strength-based social emotional screener, kindergarten through 8th grade. And then we've piloted it at our high school, our alternative high school. I'm going to be honest with you, this is not easy. It takes a lot of work and support of teachers to understand how providing this type of data or assessment is going to be beneficial for all kids. But we have some really great things happening in several of our schools in using this data to truly ensure that we're meeting the needs of all kids, not just a few, or the ones we have a gut instinct about. And so it's not perfect, and believe me, it's taken some years to get us to where we are, but it's beginning to take hold because we're being more intentional and thoughtful about it. So how is our work spreading in our district? And how do I know that this work will continue? It's interesting. There's a lot of shiny objects in the field of education. So it's a real question that our staff continue to ask about, because we've all experienced a new administrator or a new principal or a new superintendent or things like that, where we have seen things come and go. What we've done in our district is intentionally and thoughtfully and purposefully asked the question, why? We have implemented professional learning communities, and I think that through this process, we truly are gaining feedback and understanding from every teacher in our district. And I believe they're starting to see the benefit of the work that they're doing when we're truly engaged in positive or data-driven conversations around kids. And not even that, I mean, we've spent the first year and a half really talking about what is it we want kids to know, and we're building common formative assessments. And so how does social emotional learning fit into that? Well, when we're having those conversations about kids, it brings itself to the top of the conversation in regards to knowing that it does play a part in what our kids need. And then we've used an accordion system. I mentioned that earlier, where our team leads are coming together. We have a secondary team lead meeting and an elementary team lead meeting, and they, our initial focus truly was on academics. And now as we start to engage more fully in this process, we will begin to engage that team in regards to our social emotional learning. While our teacher teams have been working on academics more intentionally, our counseling teams and our leadership teams have been revisiting what it means to provide social emotional learning for everyone. And so we have decided that obviously we need to have core instruction. So our counseling team and social work team have come together to prioritize the standards for themselves, recognizing that the state hasn't quite finished the social emotional standards. We've used what they've started with, and we've prioritized those in combination with our college and career standards. So using the ASCA model as our basic framework for that. And now next steps is implementing that K-12 or preschool through 12, and then determining how we're going to, in addition to PBIS, provide social emotional learning at the core. And so we have some schools that are doing some amazing work around that and are already doing this. And it's building equity, it's building confidence, it's building systems of support that truly are supporting kids. So what advice would I give? I think you always have to start with the why. The question we asked every single staff member in our district, and what we've asked ourselves over and over and over again, is, what do you want for your child or a child that you care about? And we've intentionally taken the time to write that down and think about it, and then ask the question, is our current system meeting that goal? And We have lots of things to celebrate in Cheney. We're doing an amazing job in so many ways. So yeah, in some ways we are doing that. But one of the things that we have decided is that good is not good enough, that we want to be great. And so part of that is looking ourselves in the mirror and deciding what it's going to take to get every kid to that end goal, whatever that is for them. We've asked ourselves, is this an adult problem or a kid problem? And we recognize that sometimes we do things not based on what's best for kids, and we do it based on what's best for the adults in our system. And I think that that's normal. But as we get clear about what is best for our kids, we are beginning to make better decisions based on that. So that's really important. And then how? We've definitely done some things wrong in this process. As I reflect on that, I think the two things that I felt were most important is that you have those systems for communication, feedback, and support. And that requires being really thoughtful about that, because it's one thing to tell people you want them to do something, but it's another to actually have them implement, because they need to feel comfortable and supported in that. And so most important is you have to provide a healthy dose of support and expectation at the same time. And so most of the time when our adults don't do something, it's because they can't, or they don't believe they can. And so that's been a huge lesson for all of us in our district, is that we have to continue to provide that professional development and support for our staff. So I think that concludes my part of the presentation.
Thank you, Kathleen. We do have a couple of questions from the audience for you. Do you happen to know your student counselor ratio?
Our student counselor ratio?
Social worker to student ratio.
So we have mostly counselors in our district and a couple social workers, and some of them play the same role, so it's a little bit different. But we have currently one counselor or social worker in every one of our elementary schools. And our elementary schools range in size from about 400 to 650 students. We have 2 counselors in each of our middle schools, and our middle schools are between 500 and 650 students. And then we have 5 counselors at our high school, and we have right now around 1,300 students at our high school.
And do you know, does your district have a lead counselor at the district level?
The way we do it is we have 2 team leads. So our counseling teams are part of those professional learning community teams that come together once a month. We have an elementary team lead and we have a secondary team lead. And then we also have admin support. So I lead our counseling and team with the support of Kim Leffler.
More question. How is social emotional learning disseminated universally throughout the school? Have you guys talked about that as a team?
That's what we're working on right now. So obviously at our elementary schools, we have a stronger system than we do at our middle and high. And those are the gaps that we've begun identifying. And so our middle school counselors and social workers are doing a really nice job as well as being able to get into classrooms and support students. And then at the high school, it's much smaller. But so what we're doing right now is we've been studying this year and prioritizing the standards for our counseling team. And we've made some decisions about these are the things that every student in the Cheney Public Schools will receive instructionally from our counseling team. We will implement that in the fall. And at the same time as we're implementing that, we are investigating and learning more about social emotional learning curriculum that we are going to then, hopefully the following year is our goal, but you know how that goes, it could be longer, implement school-wide. Some of our schools are already doing that in different ways. And so we've got them to learn, we've been able to learn from them, but it's not an easy task that we are engaging upon for that.
And we actually have another question for you. Have you worked at all with diversity and equity? How are you blending that with your PBIS and MTSS programs?
Another area that we are doing work upon. So it's that unfortunately we've started that work this year in regards to building school culture, and actually have goals over the next couple for next year. We've already been planning our professional development around that for next year for all staff, and that is something that we're working on.
Yeah, and Kathleen, we really appreciate you coming on to the GATE webinar just to talk about the experience of the first year. I don't think anybody expects you to have it all figured out, and I mean, it's a constant battle to just start, and it's a really brave thing to start.
Thank you. I appreciate that. It's the one thing I'd like to say about this work is that our district leadership is incredibly supportive of it, and they want to do what's best for kids, and we're serious about together improving our graduation rate, and that's a number that we can gauge our work on, but also just doing what's right for every kid. All does mean all. And it's incredibly important that you look at the whole child when you're doing that.
Yeah. Well, thank you so much for presenting with us today. We
Thank
are coming
you.
towards the end of our time. Thank you for filling out the evaluation. And if you don't have time, you didn't have time to grab it while it was up, you can always fill out the link through our GATE reminders. It's linked there as well as on our webpage. So if you ever want to let us know what you're thinking, what you'd like to see more of, less of, we also have a survey out right now for webinar time. So if this time isn't working out for you, we are planning next year, and we'd love your feedback for when we can better fit your schedule. We do want to share a couple of resources with you. One of them that we haven't talked about so far today is this funding resource. So Unlocking State and Federal Program Funds has a section in it for doing this work. So if you're interested in that, it's on pages 62 to 69. We also, of course, have a link there to the Strengths and Difficulties Questionnaire, as well as the SHAPE assessment and the SHAPE website. So if you're interested in using those tools and just checking out the kinds of questions, maybe taking it to a leadership meeting and sharing that with folks that you work with, and thinking about it as a start of a conversation, those are good places to start. Most of our images are from the Noun Project or in the Creative Commons, or from the schools that we work with. So if you're interested in those, they are available there. As we wrap up today, we want to encourage you to take a moment to reflect on the webinar and discuss some questions. So you can use the chat, the people around you, or just jot down some thoughts on a sticky note. What were the big ideas for you? What are your next leadership moves? What did you value? What questions are you still wondering about? And we'll be here for a few minutes to answer questions. And so take advantage of that opportunity and let us know what you're thinking in the Q&A if you have questions. And thank you for joining us for GATE Equity Webinar. We'll see you this afternoon for GATE Equity Webinar 201. All right, with Bonnie. And thank you so much again for joining us.